Hi, welcome back to Student Nurses Success. In this video, we're going to talk about heart failure. Remember, you can find a link to the maps in the comments section. Let's get started. Let's first talk about what heart failure is. Heart failure is really the inability of the heart to maintain cardiac output and to meet the demands of the body. In heart failure, what's going on is there is what we call pump failure. Your heart pump is not able to keep up with the demands of the body. So we start to see a decrease in cardiac output in heart failure. Now, heart failure is the consequence of other heart conditions, such as maybe a myocardial infarction, where a part of the heart has died and now it's no longer working. Or a lot of times it's the result of high blood pressure. With high blood pressure, what happens is the heart weakens over time. When the heart has to pump against a high blood pressure or high systemic vascular resistance, what happens is over time, the left ventricle just simply wears out. So we see high blood pressure or hypertension as a common cause of heart failure. The other common cause, like I said, is myocardial infarction from coronary artery disease, where a piece of the heart muscle has died and no longer then contracts or works. With heart failure, as the heart muscle weakens, there is a significant decrease in the cardiac output because the pump is failing. As the pump fails, we start to then see a backup of blood. The blood first backs up into the lungs, and we will see lung congestion. And then eventually it'll back up into the right ventricle, the right atrium, and into the peripheral system. Now, there are two types of heart failure, systolic heart failure and diastolic heart failure. In systolic heart failure, the heart cannot contract. It's often due to maybe a piece of heart muscle dying in a myocardial infarction or possibly from cardiomyopathy. What we see in systolic heart failure is ejection fractions that are less than 40%. Now, ejection fraction is the amount of blood ejected from the heart, and a normal ejection fraction should be somewhere about 60 to 80%. Now, no one can eject 100% out of their heart because the heart has to remain with some blood in it. So 80% would be an excellent ejection fraction. As we get older, ejection fraction does decrease. Now, in diastolic failure, what's happening is the heart cannot relax. It becomes stiff and it cannot fill as well. So, in those particular cases, we see ejection fractions a little bit higher. As we get older and our heart gets stiffer, we do see the development of diastolic heart failure in some of those cases. Now, diagnostic tests to check for heart failure or to test and diagnose heart failure include the echo, x-ray, a BNP, and history and physical exam. With an echo is an ultrasonic picture, and it's used to assess ejection fraction and flow through the heart. So we can see if flow is not moving through the heart, and we can see how much blood is being pumped out of the heart. With a chest x-ray, we can see if the heart is enlarged. Often in heart failure, our heart gets enlarged. It gets larger to try to compensate and pump more. However, a bigger heart is not better and it becomes less efficient. There's a blood test called a BNP, and the BNP will actually rise when the left ventricle wall is under stress. And we see that in heart failure. That left ventricle is working really hard to try to pump, but it's just too weak. And so we do see BNP start to rise. And the last is history and physical exam findings. These are also helpful in diagnosing heart failure. Let's talk a little bit about compensation. Your body is excellent at compensating for things. The problem is when your body starts to compensate for a weak and failing heart, it actually causes the problem to get worse. Let's talk about the process of what goes on. What we start to see is the baroreceptors in your body sense volume. That's what tells you to kind of increase volume or vasoconstrict or vasodilate if necessary. So as the baroreceptors sense a decrease in cardiac output, they are less stretched. As they sense this less stretchness and this decrease in cardiac output, they tell the vessels to vasoconstrict, and they also tell the heart to increase its rate. The problem is when the vessels all start to vasoconstrict, that vasoconstriction, along with a decrease in cardiac output, causes the RAS system or the renin angiotensin aldosterone system to cycle up. The RAS system tries to increase preload or increase volume. It does this because it senses this decrease in cardiac output and it automatically thinks that it needs more volume to pump. Now remember, preload is volume. Now, as the RAS system gets going and increases the preload, it actually does make more volume for the heart to pump. However, what it's doing is it's causing more work on the heart because it's already a weak heart, and now it has even more volume that it needs to pump. And so it actually causes the heart to get even weaker. As the heart weakens, its attempt to try to compensate is that it gets larger or hypertrophies. As the heart gets larger, it actually becomes more inefficient. It gets bulky and thick, which ends up weakening it more. So as you can see, the whole system kind of gets going in a loop and it starts over. And we end up in this vicious cycle. And that's how the body's compensation methods actually worsen heart failure. Once patients start down the road of heart failure, it tends to really not get better. They may hang out in heart failure for many years, but they also may actually cycle it up and heart failure continues to get progressively worse. Now let's talk about the different types of heart failure. The first one I want to talk about is left-sided heart failure. Left-sided heart failure is the most common thing that we see. Left-sided heart failure means the left side of the heart has become weak and is starting to fail, primarily the left ventricle. Causes of left-sided heart failure tend to be high blood pressure, where again, the left ventricle is unable to pump against this increase in systemic vascular resistance or this increase in afterload, and therefore it weakens the left ventricle. Another cause is a myocardial infarction, and specifically one that occurs on the left ventricle or in the left coronary artery. Damage to the left side of the heart will weaken it because, as you remember, when a piece of the heart dies, it can no longer contract. We also know that mitral and aortic valve problems will lead to left-sided heart failure. As the mitral and aortic valves start to fail, blood starts to back up on the left side of the heart. With left heart failure, we see two different manifestations. We see something called backward effects and something called forward effects. The backward effects are from the backup of fluid. So if the pump can't pump, it starts to back up in the system. The first backup on the left side tends to be into the lungs. So patients develop shortness of breath, dyspnea, orthopnea, which means they have to sit up to breathe, or something called paroxysmal nocturnal dyspnea, where they wake up in the middle of the night suddenly not being able to breathe. If we listen to the lungs, we notice pulmonary congestion and crackles in the lungs. The forward effects are from decreased cardiac output. If the pump is backing up, then it's not pumping forward and making cardiac output. Patients develop fatigue, they develop weak pulses, they look pale, they have decreased tissue perfusion to the body, they have decreased blood flow to the kidneys, which results in decreased urine output. So these forward effects are from the decreased cardiac output, and the backward effects are from the backup into the lungs. Now, we can also have what we call right-sided heart failure. Right-sided heart failure alone, if it's just the right heart side that's failing, that is actually not as common. The cause of isolated right-sided heart failure would be something like a myocardial infarction in the right ventricle, if there was a blockage in the right coronary artery, or if there was some type of lung problem, some type of issue such as COPD, we call that cor pulmonale, or some type of lung disorder or lung disease can actually cause the right ventricle to have to pump harder to get blood into the lungs, perhaps pulmonary hypertension or something along that lines. If the right ventricle has to pump too hard, it will over time weaken and blood will back up. Another cause of right-sided heart failure is left-sided heart failure. When the left heart fails and it backs up into the lungs, eventually that blood will back up into the right ventricle and cause the right ventricle to go bad as well. So left-sided heart failure eventually turns into right-sided heart failure. So let's talk about the symptoms we have when we have right-sided heart failure. With right-sided heart failure, we have backward effects and forward effects. Now, the forward effects are still the same. They're still related to decreased cardiac output. If the pump is failing and cannot pump forward, you're going to have symptoms related to decreased cardiac output. Fatigue, weak pulses, pale, decreased tissue perfusion, decreased blood flow to the kidneys, and decreased urine output. These are the same between right and left heart failure. We see the same forward effects. The backward effects, though, are different. When the right heart starts to fail, the backup actually ends up being into the periphery. That's where we start to see the development of edema or swelling in the ankles, legs, and body. We might see jugular venous distension or the backup of blood into the peripheral circulation. We see ascites develop, enlarged spleen, and an enlarged liver as well. So these backup effects are to the periphery. Now let's talk about biventricular failure. Biventricular failure is when left-sided heart failure has just advanced and ruined the right side and caused both left and right-sided heart failure. So in this particular case, both sides of the heart are ruined, and we call this end-stage heart failure. So you have not only a weak left ventricle, but you also have a weak right ventricle, and blood is backing up into the lungs and into the periphery, and you have decreased cardiac output. So your manifestations are both right and left heart failure. So biventricular failure is really caused from, it's really related to this phenomena where the left has ruined the right. Let's talk about goals of treatment with heart failure. When a patient is in heart failure, we're really focused on trying to just improve and prolong the situation so that they can have the best quality of life. If the heart is in complete failure, they may need a heart transplant, but at this point, a lot of people may not be a candidate. So our goals are one, to improve cardiac output, and we can do that by increasing contractility of the heart. In order to increase contractility of the heart, we may use drugs that are considered positive inotropes. These are things like digoxin. We're trying to make the heart contract stronger to pump more blood. We also want to decrease the workload of the heart. We want to make it easier for it to pump, and we can do it a couple different ways. One is we can decrease blood pressure. When we decrease blood pressure, we also decrease afterload, or we also decrease systemic vascular resistance. All three of these are the same. What we're trying to do is make it easier for that left ventricle to pump against the periphery and to get blood out to the body. So we don't want vasoconstriction. We want a decrease in blood pressure so it's not hard to pump against. And we want a decrease in afterload, also known as systemic vascular resistance. We can do that with different medications. Medications such as nitroglycerin to vasodilate. We know that oxygen also vasodilates, so anything that vasodilates can help here. We know that beta blockers can be helpful as well. Beta blockers can decrease our heart rate and they can decrease our blood pressure and afterload, making it easier for the heart to pump. We also know that ACE inhibitors may be helpful as well. ACE inhibitors can help increase cardiac output and decrease systemic vascular resistance. Last, we want to decrease symptoms of congestion, and the way we can do that is by decreasing preload. Remember, preload is volume. So what we don't want is more fluid for the heart to pump. We can decrease volume and decrease preload by giving diuretics. All of these things will help the goal of treatment of making it easier for the heart to pump, decreasing congestion and volume, and improving cardiac output. And there you have it, a nice little map on heart failure. Remember, you can find a link to the maps in the comments section, and remember to like and subscribe so you're up to date on all our videos.